Andreas is not, he's not coming, people. Sadly had a situation. Annette is with us. Welcome to the Digital Week. My name is Giulio Prina. First time I say that on all the 10 slots. Let's start right now. One thing important to know, this time Annette will be doing this in a little different format. She's gonna bring presentation, answer questions, presentation, answer questions, and again. So feel free to ask your questions using the Q&A button. And now, without taking much time, Annette, please, the floor is yours.
Thank you so much, Julio. We're glad we can hear you now. Yeah, welcome everyone. I'm glad and thrilled to be here with you. I'll be presenting on the future of health, which is a super exciting topic. And I'm glad that I can actually finish up this digital week with such an important topic, because digitization in healthcare is certainly something that is here to stay. So my name is Annette. I'm currently a PhD researcher at the Institute of Customer Insight here at the University of St. Gallen. And I've recently published a book on digital health, which is called The Digital Pill, together with some of my co-authors. And so today what I'm going to do is give you an overview of our core topics that we're covering in the book, and hopefully get you excited about all the changes that are going on. We believe that, and I'll start my presentation now so you can actually see. So 1 second. Right. Share my screen with you. Okay, so digitization is, 1 second, for some coming up. You can see my slides, so that's the most important thing. Okay, this is me, this is the book. We've already talked about this, and now we can jump right into the topic. So there's an inevitable evolution towards a more digital and more patient-centric healthcare system going on. And today I'm going to take you through this in 6 steps. And this presentation is meant to be interactive. So I'll stop and pause 3 times during the presentation, and you can ask questions and we can have a discussion. So that's the mode that we will do. Exactly. But before we start looking at the changes in digitization in healthcare, it's important to take a step back and to understand where we come from. So we've actually come a long way, and medical progress is a success story, is probably the investment of the last 150 years. So it's an incredible success story, but it comes with some consequences. And one of these consequences is that we live longer. And in the past 100 years, life expectancy has actually doubled. And one of the core drivers behind that are, the 2 core drivers behind that are 2 innovations that are really groundbreaking. One is antibiotics, and the second one is vaccines that we right now hear a lot about because of COVID. And when we look at the graph, which I brought here for you, it's actually quite clear. We can see that the blue bars are life expectancy, and that's kind of going up. And we can see that at the same time, the deaths from infectious disease are going down. And so this is because of these 2 innovations, antibiotics and vaccines, which have really led to a change and tremendous improvements in healthcare, which is why previously people died at very young ages because of some infections, and that today doesn't happen anymore. This trend isn't over. So for Switzerland right now, I think women have a life expectancy of 82, and this is going to increase to 86 by the age of 2050. So this trend continues to go on. And it's a really important trend, because as we live longer, this has a huge impact on our healthcare system. And it's important to understand this demographic aspect as much as other technical aspects or other scientific aspects that are changing in the healthcare industry. We talked about infectious disease going down. At the same time, we see non-communicable disease, so disease which we can't transmit between you and me, increase. And what you see here in this graph is an indicator by the World Health Organization. It's called years lived in disability, and these are years where someone is impacted traumatically by an infection, by a non-communicable disease, and potentially can't work anymore and has limited capabilities. And these years lived in disability have increased over 30% within the last 20 years. And when you look at the example of diabetes, it has the average age to be diagnosed with diabetes in the United States is actually 45 years young, I would say. So when you compare that to the life expectancy that I've just shared with you, we know that today someone who's diagnosed with diabetes will be treated over 40 years with this disease. And obviously this is not only a tremendous burden for the person, it's also a burden to our healthcare system, because for 40 years we would have to pay medications and treatments for this patient. Overall, it's important to note that this is not only a problem of the Western world or the developed countries, it's truly a global problem. And we can see that very nicely in the case of China. Here you can see the case studies of diabetes in China. And what you can see is that from 1980 to today, the diabetes prevalence in China has actually increased from just 1% to 11%. So 10 times increase within a very short amount of time. And in Switzerland, actually, diabetes prevalence is only roughly about 4%. So you can see that Asians, because of the genetic disposition, there is some, they more easily get diabetes, even when they're not obese. But obviously, you can see that the increase in diabetes in China correlates one-on-one with the increase in GDP. So as the green line GDP goes up in China, so does the diabetes prevalence. And this leads me to one important point, is that all these non-communicable disease, we don't just get them because of genetic disposition. Our lifestyle has a huge impact on whether we get these diseases and at what age. And when we look at the top 5 non-communicable disease, then we see that these are basically top 5: cardiovascular disease, respiratory disease, diabetes, cancer, mental illnesses. And below that, I brought you the prevalence, the global prevalence. And you can see that millions and millions of people are suffering from these diseases, and often for multiple years. And so you can imagine that this is what's keeping our healthcare system busy right now. And so that's why I'm actually talking about this to you, because when we talk about the future of health, it's important to understand first, what is it that our healthcare system is dealing with? What is it that we have to find smarter solutions for? And so, as you can see by these numbers, these non-communicable chronic disease, they're really overtaxing our healthcare system. And what I mean by overtaxing is that when you look at healthcare spending in Switzerland particularly, 85% of our healthcare spend today is really driven by these non-communicable disease. And so this graphic shows you the per capita expenditure on healthcare, healthcare per capita expenditure from 1970 to today. And what you can see is that this is a constant trend up, and it's actually not linear, it's more almost exponential, we could say. And it's interesting that, I mean, the #1 country that is right on top is the United States, but followed by Switzerland, actually. So Switzerland has the second most expensive healthcare system in the world. And these healthcare costs are increasingly becoming a problem. And this healthcare cost problem is one driver as for why digitization of our healthcare systems is becoming so important. And so in the US, where I've lived for 7 years, lived and worked there, so I got to experience this healthcare system firsthand. Healthcare costs are actually the #1 reason for private bankruptcy in the US. And I think that's something we can't imagine here in Europe. And we think like, well, that's crazy. That sounds crazy. But we're not, of course, we're far away from that in Switzerland, but at the same time, not that far away. Because when you ask Swiss citizens about what they worry most about, this year is a bit different because there's COVID. And so COVID has come up quite high in what people worry about. But if you look at the years prior, healthcare was always within the top 3, basically, of their concerns, right there with pension savings. And in Switzerland right now, people basically say, well, rising healthcare costs is as big of a problem as climate change. And I think we probably all agree climate change is a big problem. So healthcare costs are a big problem. And why healthcare costs increasingly become a problem? Well, because I mean, things get more expensive over time. That's normal. That's what we're used to somehow. But when we look at how healthcare costs have developed compared to the GDP, which often correlates with income, your personal income, we can see that healthcare costs have overproportionally increased in the last years. So I brought you again a couple of countries for you to get a feel for what's going on globally. So in the United States, for example, healthcare costs have increased by 30%, while the GDP has just increased by 10%. In Switzerland, it's quite similar, not as dramatic, 22% and 8%. You can see in Japan, healthcare costs increasing by 32 times, not 32%, sorry, 32 times. While GDP has only increased 12 times in that time frame between 1970 and 2017. And Japan is certainly a case where the aging of the society is probably already impacting most. So they have a very aged society. So so you can see that this is a country where you see that gap quite high. So you could probably say, why do I care? Well, I think it's important to understand what our current system does. And I'm a big fan of our current healthcare system, and I think it's really good. But we're tremendously successful in treating disease. But I think where we can get much better on, and where we're failing right now, is preventing disease. So we've become very good in not dying from cancer, for example. Obviously, people still die from cancer, but much less, and we've become much better in treating difficult disease. And many diseases you don't die from anymore today. But we still don't manage to prevent. We kind of focus too much on treating disease, and we don't focus enough on preventing disease. And why preventing disease is so relevant is because, and I already mentioned this previously in the presentation, non-communicable disease, or the disease that are kind of the major burden for our healthcare system today, they're not just there because of genetic disposition. We don't just get them, but experts say that 50% of our risk of getting these disease can actually be prevented or delayed. So it's somehow in our hands. And the World Health Organization has published 4 risk factors that they say are the main causes behind the rise in non-communicable disease. And one is smoking. The second one is alcohol consumption, if it's too extreme. The third one is being physically inactive. And the fourth one, the last one, is eating unhealthy. So much processed food with an excess salt consumption. And so these factors sound quite common. I feel like most of us know them, but I'm not sure everyone knows the big impact they can actually have on your health and how you live in the future. And certainly this knowledge is not systematically being implemented right now within our healthcare systems. So you have, if your doctor might ask you if you smoke, or he might ask you, might ask you when he looks at your liver blood values, he might say, well, maybe drink a little bit less, but there's no systematic discussion around these factors, and there's no therapies somehow that we offer, even though they're so important risk factors causing so many diseases. And when we look at Switzerland, which I think is a quite healthy country, we can see that still in Switzerland, 1 in 3 Swiss citizens smoke. 2/3 actually of Swiss don't get enough physical activity, and almost everyone eats too much salt. So obviously we're far away from actually being somewhere where we really are managing these risk factors properly. And another statistic which just shows you that we're not as good in managing these risk factors is that prevention is coming up short, and we only right now spend 3% of our healthcare expenditure on prevention, while we spend 97%. So the vast majority is really spent on treatment. And with that, we really come to what this talk should be about, which is digitalization about healthcare. So I think one thought that we want to plant in your head, that I want to plant in your head, is that a digital healthcare system is also a healthcare system that is counting more on prevention, that is trying to detect disease more early on, and kind of changing the way how we think about health because of all the data that's going to be available. And I would say that this is probably a good time to have questions. After this, we will go into, I'll basically share with you the 6 patterns of digital innovation within healthcare that we've developed. But I think now is a good time to ask questions about the upfront part of the presentation and the trends and what's going on historically.
Great. Thank you very much, Annette. We have 2 questions here. The 3 questions. Keep them coming, people. Keep them coming. The first question is relates to the life expectancy. What about studies that show that the life expectancy will soon be lower due to reduced physical activities? Exactly what you saw. Like you've shown us, we do that badly, right? So actually,
so there's some
going
countries.
down.
Yeah, so there's some countries, few countries where we see that. One, I think the most prominent one that everyone knows about, or like that's being discussed, is the US. So in the United States, it is actually true that life expectancy right now is kind of come to an end and is kind of going down. It's really because of the opioid crisis. So they do have a big problem with opioid driving up death. But it's something that we don't see, like when you look at, for example, China, India, the majority of countries, even European countries, what we see is continued trends up, not as fast anymore, but we certainly see that it's still rising.
Okay. Second question is, what can companies do to support people in healthcare prevention programs? Which diseases should they focus on? Cardiovascular, cancer, psychiatric?
So it's a really good question. So I think it's a good question to ask first, because I mean and it's not necessarily disease that I think companies should care about, but they should care about healthy lifestyles, about their employees. Because one thing is to say, like, okay, we don't think about disease, we try to think about the risk factor, right, and catch it early on. So I think there's great examples and some scientifically proven examples where companies have, for example, encouraged more physical activity during lunchtime. And physical activity doesn't mean that you have to climb the Sentis, basically. You can just walk for 20 minutes every day, and that will give you a big impact on your health. So very simple programs like that.
Okay, so that was one of the questions here. How is insufficiently physically active scaled? And what would a sufficient physical activity look like? As you say, 20 minutes walking.
So we basically, the World Health Organization recommends 150 minutes of moderate physical activity over a week, per week, basically. So if you basically walk 30 minutes 4 4 times a week, you'll be fine. It doesn't, or even vacuum cleaning basically would be already counting as physical.
Great. We have a few more questions still. What is the most important impact? But this question is perhaps for later, would be what's the most important impact of technology today on public health? What's your opinion regarding global social inequality and technological innovation? What can we do to prevent this fact?
So I think the most important innovation, will probably come to that. So we'll go through and I'll share you the 6 patterns that we see. I'm not sure we can pinpoint it to one, but you'll see that I think data will become the backbone in the future of our healthcare system. So that's probably the underlying, it's not a technology, but it's the underlying thing that will make our healthcare system run in the future.
Great. Let's make a few more questions and then stop, because otherwise we don't have the time. One came in the chat here. What do you think are the limiting factors that keep investment into prevention so low?
So I think we're a society that's short-time oriented, right? Like prevention today, we don't see the payoff immediately, because if I'm unhealthy today, if I don't move enough today, if I eat junk food today, I don't get diabetes tomorrow. I probably get diabetes when I'm 40, which isn't that far away, but some years still.
Okay.
So that's why we don't invest. I think we're too short-sighted.
Okay, that ties very well to the next 2 people. You have to stop writing questions now because we have to continue.
We'll pause now. We'll pause now. We'll continue.
I will bring this later on, perhaps again, because we have a lot of questions. But sadly, we have to continue.
Okay.
Okay, so I disappear again. See you later.
I'll share my screen again. Perfect. So talking about prevention and digitization. So digitization is certainly one key factor for the future of our healthcare system. And oops, no, it doesn't want to move. I'll probably have to maybe do it. My slides don't want to.
You usually have to click one time to get the layer right.
Okay.
Yeah, now.
Now we go. Here we go. Perfect. Okay. So within our book, we basically we distinguish 5 levers of digitization. So that's basically where digitization, the changes it's driving, and then afterwards we look at pattern. But where we can see where digitization is changing the healthcare system is, one, it can be great to support behavior change. So that's mainly behavior change towards more healthier lifestyles, and technology can be great in doing that. Second, we see that digitization can create efficiencies. So that's something that business people always like. So I'm thinking that there will be some HSG alumni here. So basically that's creating efficiency is certainly something that digitization can do. Improving access to healthcare. So this is all about not thinking about just us, but thinking about people also in Africa who don't have access right now to qualified doctors or in other remote areas, basically. And digitization can really change their access to healthcare. And I think that's a great thing that digitization can do. Fourth, it can improve the quality of healthcare. So I think oftentimes we associate digitization with simplification and potentially with less human care and less quality care. But actually the reverse is true. And I'm hoping that I can show you a couple of examples as to where digitization is really improving the quality of care and will improve the quality of care in the future. And then lastly, it can accelerate medical progress, and we'll look at that as well. So what we've done for our book and what the basis for what I'm sharing with you now is that we've looked at this wave of new digital medical devices and service providers, which is coming our way. And we basically wrote case studies on over 300 startups that are coming up in the digital health space. And we looked at them and studied them, and we tried to say, okay, what are commonalities between these startups? How could you cluster them? What do they do? Where do they drive value? And so we came up with 6 patterns, and I'm going to share these 6 patterns with you now and give you a couple of examples, concrete examples. So we call them the 6 patterns of digitization in healthcare. So the first pattern that we want to share with you, or that I want to share with you, is do-it-yourself medicine. So do-it-yourself medicine is all about the patient being more informed in the future and the patient-doctor relationship changing. And I think that's something I recently gave a talk in front of an executive board of a clinic in Switzerland. And I think that's one core message that really resonated with them. And that's important to hear. The relationship between doctors and patient is already changing and will change in the future. And it's going to be more of an equal level playing field. So what we see is that there's more and more patients doing online digital research. So medical knowledge with digitization is more accessible to everyone. It's not in these big medical books anymore. We can just use Google, we can search, and we actually know that in Germany, already 6 of 10 consumers research their symptoms before they go to a doctor. Then second, there is self-diagnosis tools and triage. So I think for a long time, and it's probably good to hear for everyone in this webinar who has a medical background, I think doctors will still be the best way of treating us and of diagnosing us also going forward. But for this first assessment and basically the guiding into the right direction, digital tools can do a great job. And so the self-diagnosis and triage is something that where there's a lot of offerings popping up in that area, and where we see that a lot of value can be created. And so more and more health insurance companies are actually using mobile apps like symptoms checkers. I think also here in Switzerland, you can see even ads at train stations advertising that, to say, okay, before you walk to a specialist and you create a lot of costs, and that specialist is maybe not the right one, so you're not getting good quality care, it's better to actually have you check a couple of symptoms, and we can send you to really the person that can help you. And so this is an example where better quality and better and lower costs can actually go hand in hand. There is a third area that we see a lot, which is patient communities. One big community in the US, but also globally, is patients like me. And these communities are really there for patients to connect and to exchange, and also to acknowledge that when you have a disease which is rare, you as a patient really become an expert, and you're so interested in treating, like in getting treatment, that you will know everything about your disease. And so these patient communities allow you to basically find people who have the same problems and to exchange with them. And also from psychological support point, these patient communities have shown to be tremendously adding value basically to patients. So you can imagine patients like me a bit like a Facebook of where you, instead of talking about your family and your friends, you talk about the disease you have and the symptoms and all of that. Self-quantification is also something, a sub-pattern that's going on within do-it-yourself medicine. And here, I think one important statement is that we can't manage what we don't measure. And when you think about blood pressure, for example, right now, someone who has elevated blood pressure gets the blood pressure taken when he goes to the doctor, but he maybe only goes every other week. And so what happens in between is not necessarily registered. And we have this kind of spotlight medicine right now where we treat patients based on a very limited database. So only the measurements that are taken by the doctor. And so what we see as a trend, and where digital devices can really improve the quality of healthcare and also expand basically the areas of actions for doctors, is that digital devices can basically constantly track you, be it your blood pressure or your blood sugar, and really add value because we have a more continuous healthcare system instead of that spotlight healthcare system that only looks at you once a year when you go to the doctor or every other week when you go for your diabetes checkup. Then we have do-it-yourself tests. So I think with COVID, everyone now knows in Switzerland about do-it-yourself tests. So, but I think it's also quite new, right? So we don't need to go to a lab or a doctor anymore to do many tests. We can do them at home ourselves. It's more convenient for us. And also it's cheaper, basically. So this is another example where convenience and efficiencies can go hand in hand, powered by digitization in healthcare. And there's certainly more advanced tests. So I think Israel has great startups in that area, where even like small blood tests, basically you can take a little bit of blood yourself, and together with the camera from your smartphone and a test strip, you can do really sophisticated blood tests at home. And so this is an area which we see a lot of growth in and a lot of opportunity. And then there's citizen scientists, smaller area. This means where like basically you as a consumer, as a patient, become scientists and kind of do research yourself. I think that's not as important to cover for us. So we'll continue. And now it's on you again. So what we are doing now is I want to know about you, so like about your experiences with digital healthcare. So you can go to menti.com with your phone, for example, and type in the code that you see right now up here on the screen and answer this question. So the question is, do you research symptoms online? There's 3 answering options: yes, before going to the doctor; yes, after going to the doctor; and yes, I let the experts judge. And so I'm interested in how experienced you are with online research. Okay. And we have some first results coming in. Okay. So I think you're beating the average in Germany, this group. So we have a very digitally savvy group here. So it seems that 76%, well, numbers are still changing and coming up, but most of you do research, yes. So 70% of you do research prior to going to the doctor. So you go informed into your appointment. So that's a bit more than the statistics that we have from Germany. So that's quite good. And then 21% say that they go, yes, and do research after going to the doctor. So some of you maybe might do both. And then we have 8% who say, no, I let the experts judge. So we have some who say, like, I don't want to go into this cyber mania, and I don't want to read about my health. I'll basically let the experts judge. So that's quite interesting. Okay, so then thank you for participating. We'll continue with our next pattern, which is remote medicine. So remote medicine opens up new opportunities both for patients and for providers. And so what we see here is that the underlying trend behind this is that patients in the future and already today are becoming more like consumers. So patients want to have more convenience when using the healthcare system. And so that's something that also resonated, or like I think is a relevant trend to know both for doctors and providers. So if you work in a hospital, it's certainly something that's important for you to know. So when you ask patients, increasingly they want to book a doctor's appointment, or they don't understand why they can't book a doctor's appointment online, like as convenient as ordering food, or as convenient as basically booking your hairdresser's appointment. And with that, they will also look at online reviews. So the whole topic of review management and reputation management will become increasingly important for healthcare providers, like even for small practices. As more people, I mean, 70%, you said you research online before going to a doctor. So probably also before choosing a doctor, you will research online. So this is a big area that's coming up. Second big area, which has seen a huge boom with COVID right now, is online consultations, telemedicine. So there's multiple options here. Some services, and there's more and more services which you can use and get paid for by your health insurance company. So that's certainly something that is also driving that growth. And obviously, the big benefit for you as a consumer is that, that you don't have to spend the hour of going to the practice, then sitting in a waiting room just to be seen by a doctor for 10 minutes. And then basically drive and take public transport another hour back. But you can basically be home or be at work, basically just book a conference room, have your consultation there, and then basically it saves you a lot of time, is the point. The second thing that online consultations do, and that's really interesting, is that it changes the market of doctors. So if you speak to a doctor online, it doesn't really matter if that doctor is here in Zurich or if that doctor is in somewhere else, like somewhere in Germany or somewhere in Austria, somewhere in India, but German speaking. Obviously, they need to have a license to practice medicine in Switzerland. But we see that telemedicine is really also blurring the national borders of healthcare. And there's many markets where there's a shortage of doctors. So for these markets, telemedicine can help basically bring talent in a very efficient way into their markets. A very interesting thing that we'll look at next with a couple of examples is the digital doctor assistant. And so this is not so much for patients. This is really a trend or a technological change that we're seeing that's going on with doctors. So right now, medical knowledge doubles every couple of months. I think every 2 months, actually. The medical knowledge is increasing, like basically it's doubling. And so even for specialists who just have a very small area that they're working on, it's becoming increasingly difficult to always know the most recent knowledge in healthcare. And if you think a doctor basically who is basically a private doctor in his clinic who has been trained maybe 20 years ago, for this doctor, it's becoming even more so difficult to stay on top of all the technological developments. So we see that there's going to be more and more digital assistants who basically help doctors always be on the know about the most recent developments, and who can also ensure that doctors, even if they have maybe low case numbers, always follow the gold standard of treatment, so that they always follow treatment protocols, and they can be kind of like an assistant that just helps you remember certain steps, or helps you basically proposes you what's new and what you should consider potentially. So they work hand in hand with doctors. And as I said, we'll look at 2 examples. And I think this is one area where really digitalization can increase the quality of healthcare. Online pharmacies, I think it's quite straightforward. One-stop shop platforms. So this is another big trend that we're seeing. I think important to know is that we see more and more vertical integration within the healthcare system. So as consumers, as patients want more convenience, they are less willing to basically first go here and then go there and then get your medications from a third place. But there's going to be more integration. So doctors more integrating with maybe a pharmacy, which then sends you the medication to your home, so that when you leave a hospital, you don't leave just with a prescription, but you basically maybe already the medication when you leave the hospital was already sent to your home because the hospital took care of that. Booking platforms integrating into hospital systems, telemedicine platforms, which maybe right now are independent startups integrating into healthcare, into hospital systems. But we do see that there's going to be more one-stop platforms of players who right now are still individually organized. Lastly, there's mini clinics, and I'll explain that to you with an example on the next couple of slides. So before we go to the mini clinic, one example, as I said, on a great digital doctor assistant. So this is RedLogix. It's an FDA-approved algorithm which helps doctors diagnose CT scans or X-ray scans. And what we see here is that they've done testing on their algorithm, and they found actually that the algorithm is as good as diagnosing, in this case it was, I think, lung cancer, as experts, as radiologists. And so I think this technology obviously can create a lot of value, especially for clinics which maybe have lower case numbers, where doctors are less experienced. But it can also support big clinics where it just saves doctors time if like the algorithm does the pre-diagnosis and then the doctor just does the last check of looking at your scan. And so with that, it's time, enough for me talking. It's time for another question on Mentimeter. So I think your next question should already be up there. So I'm interested in knowing who of you would feel comfortable for your CT scan to be diagnosed by an algorithm. And I'll read the answer options to you. So the one answer option is, no way, I don't believe that AI is there yet. Then second answer is, no way, even though I think AI can do this. Yes, but I would prefer the doctor. Yes, if it brings me cost advantages. And then lastly, yes, I believe in the power of technology. So I'm interested to see how you vote. Again, you should be able to access the poll by going to www.menti.com and then typing in this code. And I'll show you the answers. So I think answers are still coming in, and they're quite surprising or interesting to see. So we have just one person who says no way. So that's surprising. We have a lot of people who show openness. We see that now even more people say, yes, I believe in the power of AI. There is also a big share of you who say, yes, but I would prefer a doctor. And then 2 of you say, yes, if it brings me cost advantages. So obviously, if you can save some costs there by going to a different tariff, this is okay. So very interesting. So very technically open group here. Okay, so we'll continue. And I'll show you another example. I just brought the cases which I thought are most interesting. I'll show you another example of a doctor-patient assistant. So this is actually Zuki. It's called Zuki. It's developed by the company Helio. And it's a voice assistant. And so in Switzerland, doctors actually spend 50% of their time on administrative tasks. And when you think about salaries of doctors, that's quite a waste of time somehow to have them spend so much time on administrative tasks. And so this voice assistant basically is like an Alexa for doctors. So it helps doctors reduce time in documenting medical history. And they've done a study at a big hospital chain, and they found that when using Zuki, the time of documentation was reduced by 50 to even 70%. And how Zuki works is basically that it's a learning voice assistant algorithm. And so, for example, a doctor will say, Zuki, I've just done my regular diabetes counseling. And then Zuki knows that regular diabetes counseling means first checking the family history, then talking about nutrition habits, then talking about physical activity patterns. So basically Zuki knows what to charge and knows what to document, what was discussed. and it's a learning system. So you can basically, as you speak more with it, as you train more with it, it's learning, and it's individualized for each doctor. And so I think it's clear that as these systems become available, there should be no reason why we don't use them, because they can make lives of doctors easier. And I think that's where technology is nicest, if it doesn't come on top, but it really helps you facilitate some of the processes. Then we had the mini clinic as one example also of the remote doctor relationship. So this is an example from China. Ping An is one of the big technology firms in China and also health insurance in China. And they have these mini clinics. They look like photo boxes. And what you can do as a patient is you go in, and this clinic is able to diagnose and treat the 2,000 most common disease, so many infectious disease basically. And you go in, there's a touch screen with a chatbot, and this clinic also has the opportunity, it has some sensors, so it can take your blood pressure, it can look into your eyes, it can look into your ears. So there's some instruments where you can do all of these things. And then on top of that, you have the chatbot, where you basically, and symptom checker, and then the algorithm diagnoses you, and the doctor checks the diagnosis in the background, and you can even get a prescription. So you see that there's a vending machine next to this mini clinic, and this vending machine has the 100 most common prescriptions. And so you can leave within a couple of minutes of being in there, and basically even have your prescription and go home again. And these clinics are set up in transportation hubs, in front of big sports stadiums. So basically where the people are. And I think it's an interesting way. Basically, I'm not sure Switzerland would be open to this, but it's an interesting way of treating large amounts of people in a very efficient way for the disease, which aren't as complicated to be treated. Where right now here you often go to a general practitioner. So we can see some countries are much more advanced. Okay, so I think I have to speed up a bit and to talk a bit less, because we're right now in pattern number 3 and we have 10 minutes left. So I'll try to be a bit more top line with my commentary. So digital therapeutics is the third area that we see. This is all about therapies which are enabled by technologies. They can be prescriptions, so they can be prescribed by you like a doctor, or they can be more lifestyle oriented, so you can download them yourself in the App Store. I think the big advantage here is that digital therapeutics, you always have your phone with you, so it has a better access to the patient than traditional therapeutics. And so it's a great way of basically improving care. And then also in the adherence area, we know that almost every second prescription is not taken correctly. So obviously your phone can also help you, guide you through, and remind you of like taking your medications on time, which can then improve the quality of traditional therapeutics. One example of a digital therapy is TiniTracks. It's a therapy that you get on your phone. It's about tinnitus, so when you have hearing problems, and it's a music-based therapy. And in Germany, you can actually, your doctor can prescribe it, and you can download the app, and so it's a fully digital therapy. Pattern number 4 is all about health data and data security. And you asked me before, what's the biggest change? And I think the biggest way of thinking is we have to think differently about how we deal with data in our healthcare system. And so right now, when we think about data in healthcare, we mostly only use 4% of the data that's available. So 4% is the data that comes from randomized controlled trials. So these studies which are used to get medications approved. And they're done in a very controlled way, and it's a very high quality data. But we also know that as you and I live every day, we produce data in theory, that right now, or as we go to a doctor, we produce data that right now is basically stored potentially in a paper-based way, or it might be stored in a closed system of a doctor. But where we have to get to in the future, and what's really the backbone of a modern healthcare system, is a good data infrastructure. And so it's important that we find ways to save data in a machine readable way and in a high quality way, that we find common standards, because these health databases can become a real competitive advantage for healthcare systems in the future. And I think one example where we see that right now is with COVID, where, for example, when you see at vaccines, they've all been approved, and they've done clinical trials with basically 15,000 people. But now that we're giving these vaccines to millions and millions of people, we see other side effects coming up that are very, very, very rare. And so that's why we didn't necessarily see them in the improvement studies, but we're seeing them now, because we're now giving them to millions of people. And right now there's a lot of attention basically on COVID. So that's why we're registering all that data, and we are basically very fast to analyze it. But this is why, for example, with the blood clots, we were now able to take action, because we collected that data in a digital way, and we can basically analyze it. And certainly Israel is, for example, a country which is even better in collecting the data. But we can see the value that can come out of this data, and that usually we don't collect as good, basically. And so we're giving away a lot of insights. To obviously analyze these large amounts of data, we will need AI, to help us analyze that data. And obviously also data security is becoming more important. With data security, I'll just make one comment. It certainly is important. It's something that's coming up in every discussion, especially when you talk about medical health records. What I always say is that data security is important everywhere. So we have ministries, like foreign ministries being attacked. We have companies like Microsoft being attacked and having data security issues. So in general, we have to become better in data security, but this is not a problem that's particular to health care, basically. And the solution can't be to go back to analog systems, because having data available is bringing a tremendous value, and we just need to work through these security concerns as we do in all other areas of business as well. Value-based medicine is the fifth pattern that we've seen. This pattern is all about transparency and variability in remuneration. So I think you can always see that digitization brings transparency. And as we have more transparency, it's easier to see which healthcare provider provides which quality at which cost. So what we can imagine in the future is that health insurance companies, for example, will be more picky in the doctors you can choose. They will potentially send you to a hospital which has a good record in doing a certain procedure with minimal complications and at a good quality cost. And I think this is becoming more transparent. And obviously the glue and connecting point behind all of the data points is then your medical health record. For examples, I'll only talk about two, basically, about value-based medicine. So one is Oscar. It's a health insurance company which recently did the IPO in the US, and it's a fully digital health insurance company. And what they noticed, and this speaks to value-based medicine, is that when they use they have this concierge team and have an app, and people who use their app, 21% of the people who wanted to go to an emergency room, which is really expensive. When you go to an emergency room, it's the most expensive way of care. They could basically reallocate and basically convince of choosing a different way and different access point to the healthcare system. So that's an example where basically digitization can save costs. Another example is certainly diabetes. We saw how many people have diabetes, and even though we treat these patients with extensive therapies in countries like Switzerland, 50% of patients actually continue to have high glucose values. And so I think in the future, we're not going to accept this, but we will certainly basically expand diabetes therapies with digital coaches, which we have on our phones, to really make sure that you don't only take your medication, but you really also change some of your lifestyle behavior, because that's the key basically of getting your health improved. And then, yes, we don't talk about cancer or immunotherapy. So we'll skip that. So the last pattern is digital drug development. And what we see here is that just the way how we develop drugs can change because of digitization. Overall, digitization can accelerate the drug development process, for example, by process improvements like improving the recruiting in these studies. But one important factor where digitization comes in drug development is really that it allows us to treat and to find new drugs for disease that before we couldn't do. So one, for example, is Alzheimer's, which is a neurodegenerative disease. So when someone has Alzheimer's, it's oftentimes too late to treat it because your neurons have already started to degenerate in certain areas. And if we collect data, basically, from a person who has Alzheimer's, so when, let's say, an older lady gets Alzheimer's, we in the future will have her health records, and we can say, okay, what kind of patterns can we see from all the people who got Alzheimer's if we look at their medical records from the past 70 years, basically, that we will hopefully soon have in great databases. We can look at that and basically say, what do they have in common? Do they have a common DNA genetic disposition? Do they have a common lifestyle habit? Do they have common disease that they have, maybe some infections that have caused Alzheimer's or that they're causing Alzheimer's? So this is a completely new way of looking back in looking back in medical history basically allows us, especially with these mental disease, allows us to find new ways. And so I think it's we see more and more pharma companies not only having scientists like chemists and physicians basically in their development teams, but we see them have computer scientists who basically support their development teams with technologies that I've just explained. Okay, so with that, I'll go into the summary. And after that, we can have another session of Q&A. So quickly recapping what we had today in the seminar. So first of all, we started talking about chronic disease and that they pose new challenges to our healthcare systems. We noticed that digitization of medicine cannot be stopped and it's already underway. Digitization displaces analog processes where possible. An example of that is certainly the voice assistant that can help make process better. Quality and transparency in the system will increase as the healthcare system becomes more and more digital. Prevention becomes more important, and we need to rethink here. And healthcare markets are becoming more global. So this is the topic we talked about where telemedicine is allowing you to access doctors from all over the world. We see that hybrid models win. So it's not like the healthcare system will be fully AI-based. We see that this interaction between doctors and technology is where we can have better care at a better price. And then lastly, IT, so information technology, is an opportunity for physicians. It enlarges their field of action. So I think it's about this new perspective of openness to technology, where we can really say technology can help make medicine better in the future. And with that, I'll finish up, and I'm happy to answer some more of your questions.
Great. Thank you very much, Annette. Most of our people are still here. We have quite a few. And we have lots of questions, but we have to, choose a few of them. I see some that are very interesting are ones that ask about what does that mean for the future in two senses. One of them is like, okay, from what you show us, two questions will go in that direction. From what you show us, looks like cloud technologies and all this data being sent around. There's no way around that. And tied to that was a question regarding, okay, do you see that this is really a reality? And second, would this lead to sort of an obligation, you know, for us to know that, oh, I have to be healthy because I'm being tracked all the time. So perhaps my social security will, or I have to pay more or less because they know how healthy I live or not.
Yeah, so definitely two good questions. I think first question of like, will this really become a reality that we're using data and KI? I think it already is a reality in many countries. So for example, even here in Switzerland, Roche, for example, has recently, not so recently, has acquired a big data company which has cancer data from many treatment centers, which has these real world data, and they're using that for their cancer research. So it's certainly already being used in certain areas. I think we're right now far away from like many databases are not yet as high quality as we need them to really take knowledge out of them. But it's certainly something where we're moving, and especially China and the US are leading that course. So in China, they see that as their opportunity to become leading in healthcare development, where right now they don't have a history of pharma development. And I think they're really investing a lot there. So that's question number one. Question number two about the obligation. Do we all have to donate data and do we all have to be healthy? I think that's a good question, basically. And I think that's what we're saying is, or what I'm saying is, we need a discussion, I think, in society about this, right? So as healthcare costs increase, what are we open to doing? And I think regulation is always, we don't want to over-regulate, obviously. We want some freedom and people need to splurge once in a while. But it's this balance, basically, of how much do we want to regulate, how much do we want transparency? And I think there just needs to be a discussion about it. And I think what before, like everyone felt like I shouldn't wear a seatbelt, and now everyone wears a seatbelt and it's become normal to us. So I think it's just where we have to have that discussion, and where that discussion has to bring us forward.
Great. Now, two or three of the other questions, if I bundle it together, go in the direction of the people of the medical sector. Like one direction is, what are the new skills that these people are going to need now that the whole business is changing for medicine people and people that work, like even the doctors down to the radiologist. And the other thing is, these same people that, as we just said, do not have all this training still, they are the ones training the machines, right? KI needs this kind of feedback. Mm-hmm. And sometimes we don't trust it. So what's your opinion about that part, the knowledge part of the people training, and also being perhaps even supplanted by these systems?
Mm-hmm. So I think training in medicine will certainly change a bit from, like, right now you have to speak, you study medicine and you're done and you're a doctor and you can practice your whole life, and you have to basically have some trainings once in a while, but it's very limited to more of a learning. It will probably change to more continuous learning as it's also changing in many other areas. Second, I think we will see that obviously a doctor is not a computer scientist, right? And that's maybe not his strength. So I think there needs to be some openness for technologies, but I think we'll see that in big clinics, we'll have specialists as well who will also work there. So there's going to be new jobs related to digitalization, which we see big clinics then offer to basically cooperate with doctors. And certainly, as I said, KI can only be as good as the data that's feeding it. So I think more and more we'll see better KI systems and diagnosis systems. But I think in the area of dermatology, in the area of radiology, we're already fairly farly advanced, that we have systems that are FDA approved and that can be used already today.
Great. Continue to talk about regulation. Many of the questions here go in this direction of, okay, all this data going around from us. there may be fear that this is going to be misused.
Yeah, and I think that's clear and it's normal. I think, and we've seen some examples basically where there are data breaches. So certainly health data is very, very, very sensitive data. So we need to invest a lot into secure systems, into making sure that they stay on top. I think right now, but there's no way around it, to be honest. Like, I think that's how I see it. So I think it's just that to get further progress in medicine, we will need that data in a digital way. And when you think of companies, for example, if you would think of a company going completely analog and, for example, not connecting their employees and not having shared folders and shared files, that's unbelievable, basically. I think right now we would all say, well, that's a waste of time, waste of efficiency. And so in the same way, it is a waste of efficiency that each doctor has a closed system of medical records which cannot be accessed by another specialist. So we redo tests, and it's a waste of money and efficiency. And in the end, in a system where we have so much pressure on the system because of the demographic change, it's something where we have to find safe digital solutions to allow for that exchange.
Thank you very much. It sort of answers one of the questions here, which was like that the system, the health system, especially the insurance system, is sort of resistant to these structural changes, right? And one of the questions was about what of all those business models that you see would be the more feasible for the future. About the structure, you just gave the answer. Looks like it's some sort of the thing that is gonna come anyway. There was a good, I forgot who was it. It was not Daniel Kahneman who said that you start telling people that you can cure Alzheimer, and soon they will be implanting stuff to make their minds work better. And that's the step, right, in medicine. You start fixing stuff and then optimizing it. All right, so the question is, from all these models, all these 300 startups, which ones of these business models do you believe, hey, these are the ones that look like they are gonna boom? Sort of the investment question here.
Good question. I mean, there are many. I think you can't just point out one. I think there's many great ideas and great startups, both in Switzerland, in Europe, in the United States. I personally like, as I said, I like many of them. I think the ones that use data smartly and really develop new therapies, I think that's amazing because you really bring a big value to people. But as I said, there's also boring things like basically the voice assistant that we talked about. That's maybe not the most sexy thing, but it can save a lot of time and save a lot of money, right? So I think that's genius as well, if it works. So I think there's many good examples, from process optimization in areas which are more boring to really, I think one interesting area is, for example, apps that help you with even mental illnesses, so psychotherapy through apps, which is working really well. And it's surprising, basically. But as there's there's a lack of psychotherapists globally, this is amazing if it can work, basically. So I think there's many good examples, and I encourage you to read the book. And there's many good case studies. I think over 80 or 90 case studies that we feature in many cases where you can learn about some of the companies.
Great. I will finish it with a question about the non-tech people. Because we saw that even here with the Mentimeter, for example, we had less than half of our people actually answering the question from the number of participants we got here. And one participant asked something very interesting. Look, we are always talking here about the people using this, right? It's the people, like, for me to have this data means I am using an app, I'm using an iPhone, I'm using something. But there will always be, or at least for a while, there will be a lot of people not in this system, either because they mistrust it or they are just like afraid of it, whatever. What about these people? How can they be captured, or do these startups think about that as well? How do we capture the people that are, cautious about technology or have,
Yeah. So I think it's, I mean, obviously not everyone grew up with smartphones who is alive right now. And so people are more and less used to it. But I think it's a matter of, I mean, certainly is right now a transition to some degree. But I think it's already a transition which is well underway. So I think you have many, and to be honest, it's even further in the US. Like me living in the US, it's quite common. Like everyone has an iPhone. Like your grandma has an iPhone. Like I think they're a bit more tech savvy, to be honest, than European societies. But I think here it's quite common. I mean, I don't want to discriminate, but I think it's coming basically. I think soon everyone is tech savvy, and when we look at kids who grow up today, they can't even imagine a time without technology. So obviously we need to make sure that everyone still has access to doctors in a regular way, and soon I think everyone can deal with technology anyway.
Thank you very much. I guess I can finish that with an anecdote, because a good colleague from me from Brazil said that it happens, Julio. I was here with my car, and there always comes battlers when you stop on a red light. And he said, "Oh, I don't have any coins in the battler." That's not the problem. I got a QR code here. So yeah, technology is coming anyway, yeah. Right? Thank you very, very much, Annette. Thank you to all our participants. This has been an awesome week. Of course, the digital week is over with our series of webinars that are coming for you, the recording, so that you can see it, you have the papers there. But our webinar series, of course, not over. I'm bringing every time, all the time, and some new series or something like that for you people. And in fact, I would be very glad if you can send me even negative feedback, whatever you want to tell me. What can we do to improve our webinar series? What topics interesting you? I'm myself quite interested in trying very creative stuff as well, similar to Poetry Slam or Fuck Up Nights. If you think this could be interesting scenarios for you, please answer me, write LinkedIn. Hey, Julio, go for it. I will be finding the people and fielding it. Annette, once again, thank you very much. Thanks, everybody. Looking forward for the next time that we meet in the next Digital Week or other of our webinars. See you.
See you. Bye.